What's up, guys? It's Dr. Jim. Welcome to the Facebook Live tonight. As you're getting on, I just want everybody to know, number one, I am your CBD expert. You are at the worldwide headquarters of CBD Information. Welcome on the live tonight. Glad to see the people getting on. My name is Dr. Jim. I am a chiropractor of nearly 20 years here in Richmond, Virginia, and a natural healthcare expert. And I want to welcome you to the Facebook Live tonight because we got a really hot topic going on. As we've had over 50,000 views of the videos of the last couple of weeks, I keep getting more and more questions, and that just feeds these lives. So if you have questions, put them in the comments, message me. Things I want to know is, are you seeing this live or on the replay? Because I love it when you're getting the energy live, but if you're seeing it on the replay, that's awesome too. And just comment, put your name, where you're from, whether you're seeing it live or on the replay. Thanks for getting on, because tonight we're going to be talking about CBD oil and arthritis. Now, that's a really hot topic. People have been asking me questions about it constantly over the last 2 or 3 weeks, and so I just really felt like that is something we needed to talk about. Now, before we get started, what I want everybody to know is sort of a disclaimer. Number one is, I am not your doctor tonight. We do not have a doctor-patient relationship. So I want you to take everything that I talk about tonight as purely educational. Do not make any healthcare decisions. Don't quit taking any medications. Don't do anything like that without first consulting a doctor, okay? Second is I do not claim to diagnose, treat, or cure any specific disease with CBD oil. So when we talk about things like arthritis, I just want you to know that I don't say that we diagnose, cure, or treat arthritis, but I do want you to understand how CBD oil has been effective in use in people that do have arthritis and how that could work out for people. I certainly appreciate everybody liking and sharing, so please do that. Thanks for getting on, everybody. Good to see you. So let's get started. So when we talk about CBD oil and arthritis, I think it's really important to talk about arthritis in general, because a lot of people have arthritis and there's a lot of different kinds. And so a lot of times people, the one everybody thinks about is mostly osteoarthritis. Like if you think about, the old high school football player is now 60 and he got a bunch of knee injuries in high school and now his left knee is bone on bone. Okay, well that would be a type of osteoarthritis. He has a very joint-specific damage that eventually there's inflammation in that joint when it's used, and that creates that inflammation. There's wear and tear in the joint. That's common osteoarthritis. But there's other kinds, things like rheumatoid arthritis. And rheumatoid arthritis is more of a systemic type of arthritis. So in that situation, you may one day your knee hurts, and it's swollen and inflamed, and another time it's like, wow, my left wrist is swollen and inflamed, because that's an autoimmune condition where your immune system has gotten so out of balance that it starts attacking your cartilage in your joints. And the problem with it being systemic is it's not joint specific. It could attack a knee one day, your wrist another day, and it moves around the body. And so that would be like rheumatoid arthritis. And then another type of arthritis might be like psoriatic arthritis. And really, psoriatic arthritis is also an autoimmune type of arthritis where your immune system is so out of balance that it's destroying the joint surfaces inside your joints. But along with it, there's also often the skin condition psoriasis, which is an autoimmune condition. So there's all these different kinds of arthritis, and all the people that have been reaching out to me have all different variations of that, and they really want to know, do I think that CBD oil can help with those type of problems? Now, once again, we don't diagnose or treat or cure any specific disease with CBD oil, but what we do know is all of these conditions have a couple things in common. Number one is there is inflammation in every one of them. The truth is that inflammation is almost always what really causes the pain, okay? Because technically, even in a bone-on-bone knee, bone-on-bone isn't necessarily exactly what hurts, but bone-on-bone rubs creates inflammation, and the inflammation is what the nerve receptor sense as pain. And so what's really cool is, because inflammation is a common theme across all these different kinds of problems, across all these different types of arthritis, CBD oil has been proven to have a very positive impact on inflammation. That's in the literature. You can look it up in PubMed. You can look all over the place. There's tons of articles of the impact that CBD oil has on inflammation, and it's mainly because CBD or cannabidiol directly affects CB2 receptors in the body, which are heavily spread across the immune system. So what they do is they help reduce inflammation. They have a modulating impact. CBD or cannabidiol has a modulating impact on the inflammatory response. So what it does is, say in autoimmune conditions like rheumatoid or psoriatic arthritis, in an autoimmune condition, your immune system gets incredibly out of balance. Okay, there's either too many, it's called Th1 or Th2, either too many cells killing things or too many cells marking things to be killed. And what happens is that imbalance gets the body attacking its own self. And that's what starts to destroy the joints and the inflammation. And what CBD oil does is it attaches to CB2 receptors on your immune cells, and it helps bring that into balance. Because we know that CBD oil's entire goal is to bring balance or homeostasis to the body. So it brings a homeostatic event to the immune system, and it creates balance. And when you can balance the immune system in an autoimmune condition, you reduce inflammation and you start to really reduce the amount of destruction that rheumatoid or psoriatic arthritis might have long term. And that's really the entire goal, right? We want to reduce inflammation, we want to balance the immune system so that helps with pain and stiffness and all of those negative things that happen along with arthritis. So that's really, really important. It's how the cannabidiol interacts with CB2 receptors to affect not only how your body impacts pain or how your body perceives pain, but ultimately how the inflammatory body works and how the inflammation works and interacts with everything. So that's really important. That's why CBD oil is so great for all things kind of arthritic, and that's why I really recommend it. Now, people always ask me, Doc, okay, would you recommend a topical or would you recommend the oil? Which one do you recommend for arthritis and arthritis pain? And the answer is yes. Come on, Doc, give me a better answer. The answer is yes. I recommend both of them. Because in the infamous words of Rob Bass and DJ Easy Rock, it takes two to make a thing go right. Okay? Did you like that? So it takes two to make a thing go right. So what we do is we want to use a topical, and because that's going to hit a localized pain from the area where it is. It affects the receptor sites at that area, reduces pain and inflammation locally. But when you take the oil systemically, it reduces inflammation and helps balance the entire immune system. And that's going to help more globally in your autoimmune type of arthritis and an osteoarthritis. So whenever you're thinking arthritis and how do I want to take it and what should I get and which way is the best way to take it, I use these these songs because I think people remember them. It takes two to make a thing go right. Use a topical and use the oil because we want to hit pain and inflammation from the inside and from the outside because that's what's going to make the biggest difference. And in natural health care, that's really how we like to do it. If we can get an active ingredient going systemically through the body as well as directly at the location, we're going to have the greatest impact. And that's really how we want to do it. So it takes two to make a thing go right. So tonight we've been talking about CBD oil and arthritis. And it really doesn't matter what kind of arthritis we're talking about, whether it be osteoarthritis or one of the various autoimmune arthritises, is that this has a huge impact on all the arthritic type of conditions going on. And it balances the immune system and it helps reduce the perception of pain. And that's why we like it. Cannabidiol will affect CB2 receptors to affect both the sensation or experience of pain as well as the inflammatory response. It helps bring homeostasis or balance to the immune system. That's why we use it. And then what do we use? Do we use a topical or do we use the oil? Remember, it takes two to make a thing go right. We want to hit pain and inflammation from both directions. So that brings us to the point, like, well, what do I recommend? I obviously recommend an oil and I recommend a topical. Well, the reason I pick the company that I recommend is really because I looked around a lot of different companies, and what I really liked was they had an awesome topical for relief, and they had a very pure and awesome oil to take systemically. I wasn't interested in a whole bunch of other stuff. I wanted those two things because I believed that was going to have the greatest impact on my patients, because my patients have a whole lot of inflammation and pain. And I wanted to be able to hit it from both directions. So we had a great topical and a great oil, and I said, that's the company that I'm going to recommend. Now, my own personal story is, I had club feet when I was born. I've had a ton of operations. I've limped for many years. This has had a profound impact on my ability to exercise and run and do it without the pain and inflammation. Once again, we don't diagnose or treat arthritis or any specific conditions, but I just want you to know my experience has been amazing. I could not recommend it enough to everyone that's out there. If you're watching this video and someone recommended it to you and you don't currently take CBD oil or have the topical, get back with them and have them tell you, like, this is what they should take, this is what they should do. All right? But I also want you to know this. If you just found this video and you're like, wait, I want to get on this CBD train. I need some help, and I've got arthritis, and I got an elbow, a tennis elbow, or a joint, and I need some help. You message me, and I will help you. I will help you. The person who sent you this video will help you. You get with them, and we will let you know what we recommend, what brand I recommend. Also, I'm looking for people on my team. So if I know this is changing lives, it's changing my patients' lives, it's changed my life, it's working in my family, it's really working all over the country. It is a movement that is spreading. And so if you would like to be on my team, then definitely message me, let me know. I'm looking for one person in every state in the United States and one person in every country in the world. That's really my goal, because I'm going to help you and you're going to help me, and we're going to spread this across the globe. If somebody sent you this video, then get back with them and help them, and they can help you. And together we're gonna transform lives, because this is the thing. I want you to know this, because people think like, oh, big deal, I'll just take some ibuprofen. There are over 100,000 ER visits every year due to bleeding disorders from taking NSAIDs, gastric GI bleeding. People die from that kind of stuff. So as innocuous as you may think that ibuprofen or naproxen may be, is that there really are serious side effects to their long-term use. People take opioid drugs for arthritis, for all the pain and the arthritis. Listen, there's an epidemic. This is a serious problem across the world, and we can make a difference if we get this information out to people. So I want you to share it to as many people. I want like 50,000 views of this by next week. I think we can do it, because this is going to change people's lives. CBD oil can make a big difference in arthritis and arthritis pain. If we can help reduce how much ibuprofen and naproxen people are taking, we're going to save lives. If we can help reduce how many opioids and pain medications people are taking, we can save lives. And so I want you all on that mission with me. I'm glad to be here tonight. I hope you had a good time. Just remember, reduce inflammation. CBD oil helps do that. Balance your immune system. CBD oil helps your body do that. When you're attacking arthritis pain, just remember, it takes two to make a thing go right. You want the topical and the oil, and hit that pain and inflammation from both directions. Please like it, share it. And also, like I tell my son every morning before he goes to school, be your very best today. #never quit. And if no one's ever told you this, I want you to remember this, that God wants the very, very best for you. And the day you believe that, it will change your life forever. Have a good night.